Every physician understands that reviewing daily physiological measurements offers more clinical value than a single measurement on the day of the patient visit. Remote patient monitoring is a low-cost, high-reimbursement ancillary service designed to equip physicians with multiple data points on different diagnostic criteria, helping provide the highest level of patient care. Remote patient monitoring is a perfect complement to telemedicine as it provides recent physiological data to support clinical decisions, even more so than chronic care management, while generating more than double the reimbursement. The program has proven to be successful at improving patient outcomes and patient satisfaction in numerous studies. Because of this, remote patient monitoring is becoming the standard of care. In fact, almost every professional physician organization, government health policy group, and many others have advocated for its use. While most healthcare providers recognize the clear benefits of remote monitoring, most of the current options are overly complicated, relying on Bluetooth, Wi-Fi, or both, and often relying on patients downloading apps to their smartphones or tablets. This leads to confusion from patients, especially those less technologically savvy, resulting in more phone calls from your patients and lower utilization. Not to mention, many programs require upfront and ongoing capital expenses, with physicians incurring the cost of purchasing devices, smartphones, or tablets. Klarity has developed a simple-to-use remote patient monitoring program that utilizes built-in cellular transmitters that automatically send data without any extra steps from the patient. Our program requires no capital investment, just a low-cost subscription model that includes everything your practice needs to offer remote monitoring, including the devices, shipping, taxes, software, training, billing expertise, and ongoing support. Here's how the program works. First, you'll identify patients within your practice who suffer from chronic conditions, particularly if they're uncontrolled. You select the appropriate medical devices to monitor that patient's chronic conditions. For example, a patient with diabetes may get a glucometer, or a hypertensive patient may get a blood pressure cuff. Your staff will train the patient on how to use the device. The devices automatically send patient data through our software so you and your staff can monitor. Your staff will call the patient each month to counsel them on healthy lifestyle practices. The billing codes are timed, so you and your staff will need to document all time spent managing the patient, including phone calls. Much of the time you and your staff already spend managing the patient for free, such as completing prior authorizations or filling out home healthcare forms, become billable time when it's related to managing these chronic conditions. At the end of the month, you will bill one CPT code for physiological monitoring, 99454, and another CPT code for the 20 minutes your staff managed that patient, 99457. From this, you'll generate a recurring monthly revenue of $114 for each patient in the remote monitoring program, based upon the national average Medicare reimbursement rate. Physicians nationwide are discovering that adding remote monitoring is one of the best business decisions that they can make, with some doubling their income. Each patient enrolled will generate an average of $114 per month, with a total cost of just $35 plus 20 minutes of staff time, which is easily met by including time currently spent on patient management tasks. Approximately 70% of patients qualify for remote monitoring benefits through Medicare and most insurances if they have one or more chronic condition, such as hypertension, diabetes, heart failure, or obesity. This can mean hundreds of thousands of dollars in additional practice revenue. Adding remote monitoring to your practice is simple. Your Klarity representative can supply a contract for your initial device order. Once executed, your devices will be sent out immediately. Your staff will receive a short training on this simple-to-use platform. You can then distribute devices to your patients and bill for your services. You can reorder devices as needed through a simple reordering process. If you have any questions along the way, Klarity is here as your partner to seamlessly integrate remote patient monitoring into your practice.